Statins, or HMG-CoA, hydroxymethylglutaryl coenzyme A, are reductase inhibitors. These groups of drugs are used to lower cholesterol levels that are found in the liver. Statins work by preventing the formation of cholesterol in the liver. These drugs work by inhibiting the HMG-CoA reductase enzyme. The HMG-CoA enzyme is responsible for about 70% of the body's total cholesterol production, which takes place in the liver. High levels of blood cholesterol leads to the formation of plaques within the arteries. These plaques causes blockage which prevents normal blood flow, causing a reduction in blood supplies to tissues. When plaques rupture, blood clots are then formed on the plaques, causing further blockage of the arteries. This condition results in a significant decrease in blood flow to the heart and the brain. Decreased blood flow to the heart can cause angina, chest pains, or a heart attack. However, decreased blood flow to the brain's arteries result in a stroke. Plaque can also affect the arteries of the leg. If plaque is formed in the leg arteries, reducing blood flow, then the result is pain in the legs while walking. It is extremely important to reduce the level of cholesterol produced, and an effective method is the use of statins. The use of statins can stabilize the plaque, therefore reducing the possibility of ruptures, which can also slow down the rate of plaque formation. In addition to reducing the size of plaques present in the arteries. There are many advantages to using statin. They lower blood cholesterol levels, decrease plaque size, slows down the formation of plaque, and significantly reduces the possibility of plaque ruptures by stabilizing the plaques. All those factors will reduce the possibilities of a heart attack or a stroke, and possibly death. Statins are also extremely good at lowering LDL cholesterol, the bad cholesterol, as well as lowering blood fats, triglycerides, and raising HDL cholesterol, the good cholesterol. Disadvantages of statins can be divided into two categories: the insignificant, such as diarrhea, flatulence, headaches, fatigue, and sleeplessness. The second part, which is the more significant, is liver problems, which is the reverse increase in liver enzymes that causes liver toxicity. However, this occurs at a low rate. Studies by NACI, National Organization Committee, also found 9% of patients that use statins are at risk of developing diabetes. Simvastatin withdrawn due to causing severe muscle breakdown in 2001. It was the cause of several hundred deaths. Statins are prescribed to patients depending on their cholesterol levels and other risk factors associated with cardiovascular disease. If a patient only has high cholesterol levels with no other risk factors that are associated with heart attacks or strokes, then statins are most likely not prescribed. However, if you have high cholesterol plus one of the following, such as family history of high cholesterol or cardiovascular disease, inactive lifestyle, high blood pressure, poor general health, diabetes, being overweight or obese, smoking, or peripheral artery disease, such as narrowing of the arteries in your neck, arms, or legs, then statins will be prescribed. Statins are drugs that have a good success rate in lowering cholesterol. However, if the patients continue with their unhealthy lifestyle and makes no changes, then statins can only go so far. It is extremely important to implement healthy living regimen. Healthy lifestyle is the most effective way for lowering cholesterol. Lifestyle changes such as quit smoking, healthy eating, exercise, and managing stress need to be changed for a better chance of living a healthy and long life. Statins have been around for 20 years. Many different types of statins have been developed over this time period. This table shows a comparison between Advicare, Neospan, and lovastatin. Lovastatin is the latest drug that was developed in 2001. It shows decrease in cardiovascular side effects, a decrease in the digestive system problems, decrease in headaches, flu syndrome, skin conditions such as rashes, and nausea and vomiting. This table shows that there are genuine advantages to the more recently introduced statins.